So my name's Rob Dyke. I work for a company called Tactics4. We've written a module to allow us to help us do the risk management roles, responsibilities that we have in our organisation, particularly with a focus on information governance and information security. And one of the reasons that we've done this is, well, healthcare. It's a bit of a risky business. It's something that this aspect of risk is something that we have to manage in our healthcare organisations all the time. If you can think about it here, these definitions about injury, harm or loss, seemingly one of the main concerns of healthcare organisations is not necessarily about damage to a patient, but it's about the structural or financial integrity of the organisation. And you can see these sorts of risks, they come about in terms of the risk of not delivering on the performance targets for a contract. That affects your financial integrity, but other things affect the financial integrity of your organisation. Say, for example, that you had a whole bunch of computers and you didn't want them anymore, so you gave them to a third party to dispose of, and you accidentally left on them thousands of patient records and they got sold on eBay, which has only happened 3 or 4 times over the last couple of years. At least now the Information Commissioner is taking that quite seriously and handing out £500,000 fines to organisations that do exactly that sort of stupid thing. But that shouldn't really have happened. That's a never event. It's a bit like amputating the wrong leg in an operation. These things shouldn't happen. And why shouldn't they happen? Because every NHS organisation has to carry out regular risk assessments and review risks on a regular basis following an established process. One of the things I've understood in terms of working with NHS organisations over a while is that the concept of an established process really doesn't exist within an organisation or even across organisations. If we focus specifically on information governance and information security, and we look at the information governance toolkit that we all have to complete, I can see that it's done with wild degrees of variance across organisations. But it seems like this is a problem that actually affects all organisations, and of course it wouldn't be an IT show unless someone was eventually using Dilbert to labour a point. So these are my favourite Dilberts on this particular thing here. I think the one that I really quite like, if you think about some of the ones, the risk scores that have been given to organisations at the moment by the Care Quality Commission, perhaps if we reduced the input of honesty, the organisations would be ranked in quite a different order as to how risky the care was at those organisations. In researching the term NHS Risk Register on Google, I found lots of different examples of really beautifully coloured, really well formatted spreadsheets, which someone has obviously spent a lot of time as essentially a spreadsheet monkey for filling in things and assigning them scores and dates and owners and responsibilities. This is probably the best one I've found, and that's still the best of a bad lot. How do we really know what the risk reference is on the left-hand side here in the first column? How does that relate to other information systems where that risk has been registered from? What is the impact of that risk? Well, is free text a really good way of describing that thing? The risk rating. And what I particularly like about it on this one that we found is that on none of the risks had there been any progress on the actions that were listed and reviewed at the board level. Still, the review date was only March this year, and I downloaded that spreadsheet about a day or so ago. So it's good to know that we make really good progress in terms of our risk management. But we have a slightly different approach. We want to ensure that all the products that go out of the door go out to a really high quality and a really high standard, that we properly manage and see through to completion any aspects of risk that we identify in our organisation. And our approach really emphasises the lean and Kanban management style of project life cycle management. We are very interested in ensuring that when a risk is assigned to someone, that we know who owns it, that the communications are clear across all the people that need to be informed or are responsible or are accountable for resolving or mitigating that risk in some way. But I guess most importantly, the things that we really hate as an organisation are Word documents and Excel spreadsheets and sending people email to ask them if they could review a particular item on something. But more than anything, we really hate meetings. We don't like meetings. We don't need to call them because we've got friends and work to do. We don't feel bored and lonely, so we don't really have them. We get the tool to do most of that work for us. So if I think about the information governance toolkit, this is something that every NHS organisation has to do, where they try and demonstrate that they're never going to end up with a bunch of computers on eBay with some patient information on the hard drives. And there's plenty of different aspects of this. We can see here that there's a number of different segments. I might have confidentiality, clinical information, and other assurance processes. And these things have a responsible owner, and they have actions that pertain to delivering each of these projects. If I think about the various tasks that we have to have, or the risks that we identify, any particular risk, as we can see here, the risk, my secondary data center is outside the trust premises. Well, that relates to my business continuity plan. It's a new risk. I've got some time to work on for that. We can see nice and clearly the different risks and the actions that we have to take as an organisation to mitigate those risks. One of the things that we can see here in this bit is just by grouping the risks by the person who's responsible for delivering them, we can see the number of actions that relate to each risk that we've identified. So the risk of a bird flu pandemic is assigned to the director to resolve, and I've got the score underneath it, where it relates to, and the number of actions that are still outstanding in terms of managing that risk. If I look at the incident management, here I've recorded an issue against a project of losing some patient information. Had an impromptu leaving do, and the printout of our handover Word document in my pocket, couldn't find it when I woke up in the morning, had patient names, hospital number and service code on it. Okay, that's a pretty serious breach of information. Why are you even printing out that much patient information? I don't even know. Probably because you've got a really sophisticated EPR that doesn't do task management and handover very well. But if we are going to lose these sorts of pieces of information, and we do have to have, and we have a policy which means we report them to an information governance manager, let's at least know how to record those issues, assign them to a given person, and escalate them accordingly, so we can manage that whole information security, information governance breach through to its conclusion to mitigate the risk and likelihood of it happening again. So if we think about the things that we've just seen here, these sorts of ways of doing things, risks, incidents, owners, governance, across the piece, we can map all that back to that really pretty spreadsheet that we saw. Here we see the risk description in the module, we've got the score that's assigned to it, the response, but most importantly the progress. If we look here, we can see the progress. If we look further back, we can see the progress here on the right hand side. This is obviously just a demo of the screenshot. When I show you the live demo in a moment, you'll see how that risk changes, how the progression changes as we complete actions on it. And we've got the score on the right hand side. Well, that's embedded in the user interface for the module that we've got there. So the risk management module that we wrote, we've published it as open source. You can download it from the OpenERP website. OpenERP is the engine that we use for many of the applications that we make, simply because it allows us to link, for example, the project management, risk management, and HR, to link all of these things together so we know exactly who's doing what and when and what it relates to. The link to download this is on the Tactics 4 website, and it'll also be on the Skunkworks program later this week, all to check into. But as I say, one of the reasons why we're publishing this is that we know that we need to do it. We need to monitor the compliance with any number of external regulatory frameworks, and the European Medical Device Directive, the Information Standards Board guidance on developing clinical information systems, the IG toolkit. All of these things require us to identify, monitor and manage to completion risk across our organisation. We've built it on the open source ERP platform OpenERP, and there's the link to it if you want to download it and use it in your organisation. But I guess the thing that I'm really keen to share today is where we want to go next with this project. So we know that every NHS organisation has to do this. If I just think about the NHS trusts themselves, the acute trust, there are 147 of them. They at least employ 3, 4, maybe 5 people to do this sort of work across their organisation. Let's say they're all a band 7, but with a few band 9s who they report to. So if I'm asking for a Kickstarter project to help give this in a uniform and consistent way across all NHS organisations, I estimate that with £1,000 from every trust, we can develop a shared risk management module which helps us with the information governance, security and other aspects of risk across an organisation, which gives us the potential for creating a patient portal view on all NHS risk registers for any domain at any point in time. Thank you very much. If you'd like to see a little bit more, do come round and have a demo on our stand where I think it will actually work. Thank you very much.